in the Nigerian context, what I've been doing in my pharmacy is to have the staff, the pharmacists, attend to customers through the gate. So customers don't enter the store as well. We attend to them to the gate, and the staff have their mask. We have hand sanitizer, just the regular PPE you use to protect. We don't need the overall, according to CDC, that pharmacists don't need the overall. Now, let me switch to some of the recommendations by CDC that just came out about 2 days ago. They have recommended that in places like Nigeria, where, like African countries, let me use that, where the laws are not so strict, it's been suggested that pharmacy departments, especially in hospitals, can separate patients. Like, let's say somebody comes in and drops a prescription, they want to fill a prescription for a respiratory illness. It's been recommended that a section should be created for them where they can sit away from other regular patients. That way, they don't transmit any kind of respiratory pathogens to other patients. So that's one of the recommendations that have been suggested. Then the use of gloves, that has been a debate between experts. Some recommend it, some don't recommend it. For me personally, at work, I don't use it because I believe it transfers germs. You protect yourself, but you transfer a patient's, whoever the last person you waited on, you transfer the germs to the next person and to the next person and to the next person, and the chain never ends. Then the third recommendation is any pharmacy staff that is sick or has come in contact with anyone that has been diagnosed with coronavirus should stay off work until after 14 days or until they get better. The fourth one is shield screen. I wish I could demonstrate this screen. It's like a glass. It hangs on the ceiling. We don't use it in my pharmacy, but I've seen it at the post office where the screen, you actually talk to the staff through a screen. There's a plastic screen. It's very, very protective for preventing airborne infections. So they use that. That is also recommended. I've spoken about the minimum contact with patients, how to avoid, to reduce the number of times we pharmacists interact with our patients. So here, like I said, we use faxes, phoned-in prescriptions. Now, let me switch to the medications that have been used. So the CDC has recommended that, although no medication has been endorsed by the CDC, but they have recommended that we pharmacists, we can play a role in advising doctors, because they do call in to say, hey, I have a patient who's been diagnosed, so what do you recommend? So we pharmacists are the ones that will suggest the medications they should use to them. The ones we have been suggesting most here is the hydroxychloroquine, which CDC has advised not to use, but they kind of gave it a discretionary thing for doctors and pharmacists to use. So we pharmacists, what we can contribute here in dispensing this medication is to check the history of patients, because this hydroxychloroquine has a lot of contraindications and a lot of drug interactions. Me personally, I'm always scared to even dispense it, because if you don't have the patient's history, you might be setting yourself for litigation if you recommend and dispense this drug. Some of in fact, the official book suggests we use an alternative medication if the patient is on amitriptyline, ciprofloxacin, clarithromycin, clopomazine, alphonsazine, amiodarone. I mean, the list is endless. And it's mostly contraindicated in vaccines, all these immunization drugs. I mean, vaccination drugs. So dispensing it is always taking a risk. So we pharmacists can come in reviewing patient profile and recommending drugs to patients. So we have the hydroxychloroquine, chloroquine. There's a new discovery now of Pharm.Dept, which is in the same class with ranitidine, our usual Zantac that has been banned now. So there's a study now saying that Pharm.Dept is another drug that is effective against the coronavirus in combination with hydroxychloroquine. But some doctors are using it. I've never dispensed it. It's something I just read about 2 days ago. Then another medication, OTC product that we recommend is zinc. Zinc and vitamin C. I think everybody is aware of those. Zinc is relatively safe, except the patient has any kind of neurological condition. That's when you restrict yourself from giving the patient zinc. So overall, it's safe, and we know vitamin C, anybody can take vitamin C. There are also some antivirals that have not been confirmed, but they are so expensive that we hardly recommend them. I mean, a month's dose, all these HIV medications, a month's dose is over $1,000. So we hardly recommend those. So apart from that, the social distancing, there's a new thing now saying that even 6 feet is not enough. So these informations, they change by the day, by the hour. I won't be surprised by the end of today, they will have brought in something else. Because now they are saying that there are 6 more symptoms of coronavirus. That's all I have on the coronavirus and the role of pharmacists. So the takeaway from here is recommendation of medication and their interaction before we recommend to doctors. Then keeping our distance as much as we can from patients. Then separating patients with respiratory diseases from regular ones when they are in the pharmacy to pick up medication. So we should have separate sections for anyone dropping a prescription for any respiratory infection. Then that we don't need to put on PPEs. Overall, basically what we need is a mask, since we don't come in contact with patients when we are preparing their medications. So that is all I have on coronavirus. I'm going to switch to telemedicine. So I'm switching to telemedicine, which is something I'm actually writing a project on for the state government. So I'm very, very interested in this aspect of healthcare. Telemedicine, we all practice it, but we don't realize that we actually practice telemedicine. Every day, all of us practice it. But to give you a definition I have formed, telemedicine is taking care of patients, patient care, using telecommunication technology to evaluate, diagnose, treat, and refer our patients to maybe to another hospital, another pharmacy, another location, especially patients living in remote areas. So this aspect of healthcare is new. Even here in America, not a lot of people are using it, but we practice, like I said, we all use it every day. We send prescriptions through WhatsApp, through email, with text, you know. Sometimes in the pharmacy, somebody will bring, I'm talking in aspect of Nigeria now. Somebody will bring a phone and say, my doctor said I should buy this drug. And they will pull up their WhatsApp or their text message. You will see a drug there. That is telemedicine. You may not know it. So what this does, the advantages of telemedicine is that one of the advantages is it helps decongest, or wait, let me elaborate more on what it takes, what telemedicine, the different aspects that we can utilize. We can some come in form of apps. Most of them come in form of applications that you can put on your phone. You can get on there, look for a doctor. If you're a pharmacist, you can find a doctor's profile. If you're a patient, you can look for a doctor's profile. They have all forms of specializations for doctors, gyno, dentist, eye doctor, surgeon. All of them are listed on most of these apps. So you can choose. Then on those apps, you can also select locations. A place like UITH, an app can be created for UITH where you have all sections of doctors, pharmacists, pharmacy department, all specializations. So these doctors from their homes, they can transmit prescriptions from this app to the pharmacy department if the pharmacy department is set up for that. So that is the general idea of this telemedicine. And on that app, a patient can also chat with, I will send you an example of the app that everybody can look at from one of the telecommunication companies in Nigeria after my presentation. A doctor can chat, you can exchange pictures, you can exchange pictures, you can do video, you can create your patient profile and list all their medical conditions, the drug they are taking. Everything is on there with a standard app for the patient, for the doctor or the pharmacist to review and recommend a prescription. Of course, it's not all conditions that can be treated on the app, but it helps. This takes me to the benefits of telemedicine. Telemedicine helps decongest doctors' offices. Some people, especially, let me use an American example now. If somebody is coughing, if they have stomachache, if they have any little thing, they will go to the emergency room. So the emergency room sometimes, even for serious conditions, it takes hours, 4 hours, 5 hours for you to, because of some flimsy illnesses that people come for. And somebody will fall down, they will have a sprain, they will go to emergency, call ambulance, they will take them to emergency room. They will have a running stomach, they will take them to emergency room. They will be having diarrhea, they will run to emergency room. So you go there, it's so discouraging to go to the emergency room. So things like this will decongest the emergency room. The patient gets on the app, locates a doctor that is online, tell the doctor his or her condition. The doctor sends the prescription appears in the pharmacy. Before the patient gets to the pharmacy, the medication is already dispensed and ready for the patient to pay. The patient will not spend more than 2-3 minutes in the pharmacy and go home. It's convenient. Patients can stay in their bedroom, their living room, talk to their doctor, especially when it comes to follow-up. Maybe a doctor says, okay, go and take amlodipine, come back in 30 days. The patient does not have to go to the doctor's office. He can stay in her own room, check her blood pressure, give the doctor the reading. If it's okay, she doesn't have to go. You can just say continue instead of going to the doctor's office and sitting down for 2-3 hours before you see the doctor. So it's very convenient. Then less time in the waiting area for patients. Patient can sit, chat with their doctor, 2-3 minutes, they already have their drug, they are on their way to the pharmacy. It's cost efficient. You don't have to drive, especially for patients living in rural areas. They don't have to drive. They can easily talk, chat, do whatever they want on their phone or on their app. Of course, the rural dwellers, some of them might not be so savvy with technology, but rural areas, you can always find 1 or 2 people to help you with apps. Then we have transferring of electronic information. Let's say you want to transfer somebody from Pategi to Ilorin, and you want to transfer medical record from Pategi to UITH to see a doctor or a doctor's office. It doesn't have to be UITH, it can be a private doctor. The medical history can easily be transmitted electronically. The patient does not have to travel from the rural area all the way to Ilorin if he or she doesn't have to. Then there is quality of care, increase in patient engagement, reduce the exposure to illness, just like the example of separating respiratory patients from regular patients. A patient that is going for consultation, he doesn't, to follow up with his doctor, he or she does not need to come and sit among sick people and get sick. When she's just coming to see a doctor for follow-up, she can easily follow the doctor up on the app. So I think I have about 2 more minutes. So the examples of the app that I've seen in Ilorin, the active ones, in Nigeria, there are about 5 active ones, but the most prominent is the one they call Udibia. There's Udibia and there is Omomi. Udibia is a general app for all sorts of illnesses. It's a fantastic application. If you get a chance, just go through it. Then Omomi is for nursing mothers, that you can talk. If you are pregnant, you can chat with other pregnant women, you can talk with people with babies, they answer a lot of questions amongst themselves. And there's also referral on the app too. So they are very interesting apps. It would be nice for you to see. But like I said, we are trying to launch this in Kwara State and see how it can benefit Kwara and see what it will do to the healthcare system in Kwara State. Thank you.